Good morning. This is Ms. Smith, and my name is Gina Ortiz. This will be for Nursing 5303 at UTEP Advanced Assessment. This is going to be a comprehensive head-to-toe assessment. Ms. Smith is over the age of 18. So I'm going to observe in your physical appearance and your behavior, you're well-groomed, you're cooperative, you appear to be happy, cooperative. Do you have any concerns about this assessment?
No, I do not.
Okay. You have good posture, good eye contact. So I want to test your cognitive abilities. We're going to do state of consciousness, your response to analogies, abstract reasoning, arithmetic calculations,
Okay.
and memory. So can you tell me what day this is and what year?
Thursday, 2017.
Okay, great. Finish this sentence for me, please. An engine to an airplane is the same as an oar is to
A boat.
Okay. And if I told you a rolling stone gathers no moss, what do you think I'm trying to say?
That as it's moving, there's not moss, so keep moving and you don't gather anything bad.
Okay. I would like for you to count backwards from 100 by sevens.
100, 93, 86, 69.
Okay. All right. So we're going to test your memory. We're going to do immediate, recent, and remote memory.
Okay.
Please repeat these numbers. 56835.
56835.
Okay. And then I want you to remember these words, and then I'm going to ask you about them in a few minutes. Bird, carpet, treasure, and orange.
Bird, carpet, treasure, and orange.
And then I'll ask you again in a couple of minutes.
Bird, carpet, treasure, orange. Okay.
For your remote memory, what was your mother's maiden name?
Hargis.
And what was the first car you ever drove?
A VW.
A VW, okay. So I'm going to ask you to repeat a couple of commands. And I want you to raise your right arm up. Okay, and then lower it. Please tell me the days of the week.
Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday.
Okay, good. Spell the word world forwards and back.
WORLD DLROW.
Okay, and then count to 25 by 5.
5, 10, 15, 20, 25.
Okay. As a general rule, do you feel happy? Or are you depressed? Do you have anxiety?
I'm happy.
You're happy?
No anxiety.
No. Okay, great. Do you ever feel like people are watching you besides today's little adventure?
No.
No. Okay. And when you leave the house, do you just leave the house, or do you go back and check, make sure everything's off multiple times?
No. Just lock the door and leave.
Okay. Do you think you're scrutinized more than your other coworkers? No?
No.
And do you have conversations with people that no one else can see?
No.
No. All right. We're going to assess your head and neck, and we're going to use inspection and palpation. I'm going to observe your head position, your facial features. We're going to inspect the skull. We're going to palpate the skull and the hair and the temporal mandibular joint spaces for range of motion.
Okay.
So the head is proportionate to the body size. The facial features, everything is symmetrical. I want you to raise your eyebrows up. Okay, very good. All right, you can put them down.
Okay.
Okay. We're going to palpate the skull, and there are no masses or knots up here. And the hair is normal texture and normal color. Okay, I want you to open and close. I'm going to here. And I want you to open and close the mouth, moving the lower jaw to each side. We're going to move your lower jaw to each side, to the right and to the left. And then I want you to protrude and then retract your lower chin.
Like,
yes, I'm trying to push this out. Okay, very good. Okay, so I want you to try to swallow. Okay, so you can see that is normal. It is symmetrical. The trachea is midline. And then we're going to palpate the lymph nodes. Okay, so I didn't feel any. Okay, so now we're going to go to the eyes, testing cranial nerve 2, the optic nerve. We're going to do near, distant, and peripheral vision. I want you to look at this eye chart and read the top 5 numbers.
95874.
And can you see this one?
63925.
Okay, very good. Okay, and then we're going to do your distance vision.
Okay.
And I want you to look over here to the other corner of the room. And what do you see sitting on the bedside table?
It is a red basin with a water pitcher in it.
Okay, very good. We're going to do peripheral. So I want you to look straight ahead and tell me when you see my fingers.
Now.
Okay. Then we're going to go to the other side. Look straight ahead, and when do you see them?
No.
Okay. So it was even. To assess cranial nerve 3, we're going to raise the eyebrows. Very good. Now lower. Okay. And cranial nerve 6, we're going to look to see if the eyes can move laterally. So I want you to look to the left, and to the middle, and to the right. Very good. And by inspecting the eyes, they are all symmetrical and they have a straight-on look. Okay. Using the ophthalmoscope, probably not said right. We're going to look into your eyes. And the way this works, you just put the base with the battery into here, and then you can actually look in get very close to the eyes. Very good. Okay. And now we're going to do the ears, nose, and throat. We're going to inspect the ears. So we're going to look at the ears, and you can see where they are equal and they're symmetrical on each side. And they both meet about the same spot. Using the otoscope, we're going to look at the auditory canal. I'm going to tilt your head to the side, and then I'm going to pull your earlobe just up just a little bit. Okay, we're going to inspect the nose and the sinuses, where the head is going to be straight and then slightly back just a little bit. And I'm sorry. Okay. Sorry, Miss Smith. And then we could check the frontal and maxillary sinuses. Shine a bright light. And this room is actually too bright for this. It would have to be a very dark room. But we could check your sinuses. We're going to use the light source lateral to the nose, just under the middle of the eye, and look to see the illumination. But this room is too bright to do that. We're going to inspect the mouth. By clenching the jaws, you can check cranial nerve 5. So if you can clench your jaws, very good. And facial expressions, you check cranial nerve 7. So smile really big, and now frown. Very good. Okay. And that also cranial nerve 7 is clenching the teeth and smiling to see that the fit clean. Okay, so your teeth fit properly, and so that checks cranial nerve 7. Cranial nerve 9, I'm going to use this. This tongue blade has been moistened in warm water. It'll kind of lessen that gag reflex. I want you to say "ah," and I'm going to watch your soft palate. Okay, now say "ah."
Aww.
Very good. Okay. So the soft palate rises symmetrically, and I noticed that the uvula was midline. It was deviated. That would mean maybe a vagus nerve paralysis, and that was cranial nerve 10. Okay. We're going to check your hearing, and this will be cranial nerve 8. We're going to do the whisper test, the Weber test, and the Rhine test. Okay, so the whisper test, I'm going to stand a couple of feet from you, and I'm going to stand on your right side, so occlude your left.
Okay.
And repeat what I say.
Okay. Thank you for doing this.
Okay. Now we're going to go to the opposite side.
I'm less nervous now.
All right, thank you. The Weber test is to assess for unilateral hearing loss. I'm going to use the tuning fork. I'm going to place it on the top of your head and tell me when it stops vibrating. Do you feel it?
Yeah, it's fine.
Okay. Okay. Very good. And you heard it both the same in both ears?
Yes.
Okay. All right. Now the Rhine test determines if you hear better by air or bone conduction. So I'm going to place it against the back of your ear and tell me when the vibration is gone, and when it is, then I'm going to put it close to your ears. Okay, you ready? All right, that was me, I'm sorry.
Gone.
Okay, so let's do the other side. I'm sorry. Okay.
I hear it better.
All right.
Better by air.
By ear,
Not
okay.
the other way.
Okay. Okay. Okay, so now we're going to go to chest and lungs. Okay, we're going to inspect, palpate, percuss, and then we're going to listen. Okay. So your AP and your lateral is about even. Okay. I didn't notice any ribs that were sticking out. Your skin color is all even. And I don't hear any audible breath sounds like wheezes or anything. Okay. Okay, so this is for the drum test. I want you to talk to me, repeat words, just say words.
1, 2, 3, 4, 5.
Okay. And I didn't notice any crepitus. Okay, so I'm going to listen both in the back and in the front. Okay. Deep breath. Very clear in the back. Now, deep breath. One more time. Okay. Okay. And let's do the percussing of the back. Okay. Okay, so now we're going to assess the cardiovascular system, concentrating on the heart and the vessels. Okay, we're going to inspect, auscultate, listen to heart sounds, and then we're going to check your peripheral pulses. Okay. So just by inspecting, and I don't want to expose you, so, okay, no keys, no. And then we're going to listen. So I did hear S1 and S2. I didn't necessarily hear S3 or S4. No extra sounds. We're going to check carotid, brachial, radial, the femoral. We're going to not do that. Okay, it's here, so we don't want to expose you. That's why we're not going to do that. Popliteal, the dorsal pedis, and the posterior tibials. So on the carotid, we're going to make sure that we don't listen to them both at the same time. Let me check this again. Okay, no bruise. Okay. Brachial. And if you're going to do them both at the same time, you have to make sure you have the same sensation in both hands. we're going to defer the breast and the genitalia for this exam. We would make sure in the breast there's no masses, no discharges, no discharge, and genitalia. There's no unusual discharges, there's no cyst. There would also be a time that your provider could talk to you about any issues that you feel like you have, any questions. Let's see. In the abdomen, we're going to inspect, we're going to auscultate, we're going to percuss, and we're going to do palpation. So if I can get you to lay down.
Okay.
It's important to do all your auscultating before percussing or palpation, so you don't stir things up before you can really get the look and listen. So just looking, there's no obvious masses. So we're going to listen. And you've got normal active vowel sounds. And now I'm going to ask you to get back up. I'm so sorry. We're going to do the neurological, and we're going to do musculoskeletal. Okay. I should have put that right. Okay, so with the musculoskeletal, we're going to look at alignment, symmetry, range of motion, and strength. So by observing from the back, you can see that she's well aligned. There's no kyphosis, no scoliosis. Shoulders, shrug your shoulders for me. Okay, very good. When you can shrug your shoulders and turn your head to the right and to the left, that's cranial nerve 11. Okay, so we're going to do range of motion and strength. So what I want you to do is range of motion, arms up like this, and up, and then down, and make big circles. Okay, very good. Now we're going to do strength. So arms up like this. Now try to raise your arms against me. Okay, good. Now try to lower them. Good. Now let's do the same thing with the legs. Bend your knee up. You have something to hang on to. Okay, now raise against me. Okay, very good. And the same one with this side. Okay, good. All right. And the last one, neurological, we have done all of the cranial nerves 1 through 12, except for we've done 2 through 12. The one that we're missing is cranial nerve 1, and that would be smell. I want you to close your eyes. Tell me, what do you think that is?
That's like rubbing alcohol.
You're very good. Okay. All right. Ms. Smith, thank you very much for participating. I appreciate it very much.
You're welcome.
And this assessment is completed.
Okay.